Okay, so what we're going to talk about today is, say you've got a bad shoulder, painful. Actually, let me do my left here. Um, so, or if you've had shoulder surgery of some kind and you're working on progressing things, it's important to understand that if you get pain with trying to lift your arm, and maybe you're not supposed to lift your arm actively yet, but it's important to understand that the muscles that are firing are going to be different and the stabilization is going to be somewhat different. If you're trying to lift, especially when you don't have adequate strength or you don't have a functional firing pattern in those muscles to stabilize. So what you can do is use your other hand here to help support, but also if you're feeling comfortable with it, you can actually push into that bottom downward into the hand and engage a totally different set of muscles. And it actually might help you, because if you're shrugging like this to compensate the lift here, it's not going to work. If you push down here, it might help you to pull your shoulder blade down too, which is actually better for stabilization of your scapula to your body. So make sure, especially if the post-op situation, that you're not progressing too quickly with this, but you can start off with just helping with the other hand, but also putting a little tension in the other direction. That also helps to disengage some of those other muscles that might be overly tight or firing incorrectly, and focus more on training these other muscles here to actually release a little bit, which can also be part of the problem. If you've been in a sling, especially for a while, those muscles are probably going to be pretty tight. So you want to train those to take the parking brake off so that they can work eccentrically, and then eventually that might free things up so this is easier and less painful. Okay, good.